In this week's session, we will provide an overview of healthy behaviors and coping strategies to keep you going strong with your healthy habits during the COVID-19 pandemic. It is my pleasure to introduce our three panelists for this evening: medical oncologist, Dr. Betsy O'Donnell, clinical health psychologist, Dr. Rachel Millstein, and primary care physician, Dr. Peter Grinspoon. Dr. Betsy O'Donnell is the Director of Lifestyle Medicine and a medical oncologist in the Multiple Myeloma Disease Center at the Mass General Hospital. As a Division I All-American in the sport of lacrosse during her undergraduate years, Dr. O'Donnell's interest in lifestyle medicine stems from her own passion for athletics and health. Now at MGH, she works to empower cancer patients to reach their optimal level of wellness during and after cancer treatment. Our next panelist tonight is Dr. Rachel Millstein, a clinical health psychologist with the MGH Behavioral Medicine Program. Her clinical work includes the use of mind-body approaches and evidence-based strategies for managing stress, anxiety, depression, weight, and health conditions. Her research focuses on developing physical activity and diet interventions for disease populations, including cancer and prevention. She enjoys running, triathlons, dog walks, and hot yoga. Our final panelist for tonight is Dr. Peter Grinspoon, a primary care physician at Massachusetts General Hospital and an instructor at Harvard Medical School. He is a board member of the advocacy group Doctors for Cannabis Regulation and a contributing editor to Harvard Health Publications. He spent 2 years as an associate director of the Massachusetts Physician Health Service, helping physicians with addiction and mental health issues. He is the author of the memoir, Free Refills, A Doctor Confronts His Addiction. Please note that during this presentation, you will be on mute, but feel free to send in questions to the Q&A, and we will get to those at the second half of tonight's session. So without further ado, I'll pass it off to my colleagues.
Okay, go ahead. Let's see, can we have the next slide, please? Okay, so lifestyle medicine is the use of lifestyle interventions. This is to say healthy behaviors such as exercise, diet, stress management, and smoking cessation to treat and manage different types of diseases, chronic diseases. So we're going to talk about, we'll go over the 6 pillars tonight with a focus on the orange one, which is avoiding risky substances. Next slide, please. Okay, so lifestyle medicine can help patients. I'll get started and Dr. O'Donnell may chime in as well, by improving quality of life, improving side effects from treatment, from cancer treatment, physical functioning, improving mood, fatigue from cancer treatment, and improving cancer outcomes. So as I mentioned, there's 6 pillars of lifestyle medicine: exercise or physical activity, nutrition, healthy diet, healthy sleep, social connections, managing stress, and substance use. So as I say, we'll recap the 5 top pillars at the end of the session. And as we get started, we'll talk about substance use and avoiding risky use of substances. So with that, next slide, I'll pass it off to Dr. Grinspoon.
Sorry, it definitely sounds better if I'm unmuted. It's more informative. I'm a primary care doctor at Mass General, and I'm also a specialist in medical cannabis. You know, this is interesting because we're going to be talking about sort of the pitfalls of using different substances, such as alcohol and tobacco, but marijuana or cannabis, which I often refer to it as, is like a double-edged sword, because on the one hand, people can get dependent on it, and it, you know, there's no free lunch. It does have some health concerns, which we'll probably get to if we have time. But at the same time, it's something that can be very helpful to patients suffering from a whole variety of medical conditions, such as chronic pain, insomnia, and most relevant to this crowd is chemotherapy-induced nausea and vomiting. I was introduced to the concept of medical cannabis at a very early age because my brother Danny suffered from leukemia. he was diagnosed with it when I was 1, and he ultimately passed away when I was 8 years old. But my parents broke the law back then in the 1970s and prescribed and obtained illegally medical cannabis for him. And it was literally the only thing that enabled him to hold down food during his chemotherapy at the Dana-Farber Cancer Institute. And I witnessed this as a child. So my family and myself have always been sort of open to the idea of medical cannabis as an adjunctive treatment for chemotherapy-induced nausea and vomiting, as an example. So I became interested in this like very early in my medical career. So, and I treat people for all kinds of conditions with medical cannabis. But to give a brief overview, THC is the main active ingredient in marijuana. That's what gets people high or stoned, and that's what people usually seek out recreationally. And I should mention that cannabis or marijuana is very complicated. There are about 600 different molecules or chemicals in it. And, they're doing a lot of research on it and discovering new uses and new chemicals every day. But the two most common ones that we're going to talk about are THC and CBD, because those are the ones that are the most important, the most common, and the ones that you tend to hear about. As I mentioned, THC is the one that gets people high and that people seek out recreationally, and that has a lot of medical benefit for pain and for insomnia. But we're in the middle of this CBD craze, which I'm sure everybody has heard about CBD. And the thing to note about CBD is that it's one molecule within the 600 molecules of cannabis, which what's exciting about CBD is that it doesn't get you high. It has no abuse or dependence liability. So it's very low-hanging fruit. People tend to use it for pain, insomnia, and anxiety. It's also used for childhood epilepsy. A lot of people have heard that. And people are very interested in it because it has very few side effects. And again, it's very low-hanging fruit. But people also find that cannabis, which has CBD plus THC plus the 600 other molecules, tends to be stronger than just CBD. So a lot of people might try CBD, say if they're having trouble sleeping, or they have anxiety in social situations, or they have chronic pain from cancer or from arthritis. And for some people, the CBD would work, which is great because it has very few side effects. You could take it, you could drive, you don't get impaired. But then if that's not strong enough, people might want to try full medical marijuana, which has the THC, which is more effective medically, but then is a little bit more complicated because it does get you high, sort of like opiates, and you can't drive afterwards and so forth. Next slide, please. As mentioned, medical marijuana is extremely effective for treating nausea and vomiting during chemotherapy. Doctors aren't a huge fan of smoking, but these days you can vaporize medical marijuana, which means you just take the flower, the plant, as you could see in the slide, and just grind it up and put it in a machine that heats it up, and you inhale the vapor. And it's much better for your lungs and much more cost efficient. When you just burn something like tobacco or cannabis, you're actually burning it at 1100 degrees, and you get the tar, you get a little bit of nicotine, and you get all these other chemicals that aren't good for you. But if you vaporize it, you just get the chemicals that you want, what are called cannabinoids, the THC and the CBD, but you don't get all the other crap that is bad for you. So the technology has advanced. You also, if you don't like inhaling anything, or if your lungs get irritated, you can take a little tincture under the tongue, or you can take an edible. So there are a lot of different ways to take cannabis besides just smoking. But I just mentioned inhaling, because if you're feeling nauseous, often you don't want to take anything by mouth. You might want to take a puff of something. As it mentions in the slide, neuropathic pain, and I know that's a common side effect of many chemotherapy regimens. It's also just a condition that a lot of people have just in their medical care. I certainly see it all the time as a primary care doctor, and it's very difficult to treat. The drugs we have to treat, we usually use gabapentin, which is called Neurontin or Lyrica. These drugs are so overhyped by the pharmaceutical companies, and they're overpriced, and they do very little actually, besides just make you sleepy and cost you a huge copay. And I think that cannabis is a lot more effective for neuropathic pain. And study after study has shown that in states, for example, that legalize medical cannabis, or interestingly, recreational cannabis too, you see the use of opiates go down. So I see in the slide it says, need less pain medication. People substitute for neuropathic pain or for any type of pain for that reason. You know, you're getting older, you weigh 5 pounds too much, your knees start to get achy. Instead of taking, you know, eventually opiates if it gets bad enough, or even just ibuprofen all the time, which will kill your kidneys and will kill your stomach, people are starting to take a small dose of medical cannabis instead, and you need less pain medication. The issue of whether it kills or slows the growth of cancer cells, it certainly does that in the cells, and it certainly does that in animals. They haven't done many human studies yet. So I suspect in the future that medical marijuana is going to be an adjunct to treatment for cancer, but it just hasn't been proven yet. And the thing that makes me nervous is when people, you know, I deal with all kinds of people. I deal with people that are really against medical marijuana irrationally, and I deal with people that sort of irrationally are like overly in favor and imbue it with magical qualities. And it makes me nervous when people like drop out of their chemotherapy and try to use medical marijuana to treat their cancer. I do think it's going to play a role in the future, but what we like to do now is use regular chemotherapy to treat the cancer, because that's been proven, and mostly use medical marijuana to treat the symptoms. Though it is really interesting the many different ways in which marijuana does slow the growth of cancer cells. So that's going to be something really interesting that's going to come along down the pike. But you just don't want to rely only on that, because that can be really, really dangerous. Next slide, please. There was a big case in Oregon where this woman took her teenage son out of treatment. He had a big tumor in his liver, and she wanted to treat him with just CBD. And the state said, absolutely not. You need to give your son chemotherapy. He was just 13 years old, and not try to treat him with just CBD. And I agree with the state. I don't think there's any evidence that just CBD would treat a cancer by itself. But certainly some of the studies of like these brain tumors called glioblastoma multiforme, as an adjunct, some of the survival is much longer if you add cannabinoids, different types of medical marijuana. You know, it's interesting. A lot of the research is being done in Canada, Europe, and Israel, because it's very restrictive still in the United States. It's legal in a lot of states. Luckily in Massachusetts, it's legal both medically and recreationally. So it's not that difficult to access medical marijuana as a patient, but as a researcher, it's still really difficult to do studies. There are possible harms of marijuana. You know, there's no free lunch with any medication. That's like the first thing I say to any of my primary care patients. You know, one yardstick I look at is it more dangerous than whatever else we would be using to treat this condition? Now, what do we have to treat insomnia? We use Ambien, people use Benadryl, some people use benzodiazepines like Valium or Ativan. And, you know, certainly I think marijuana is less dangerous than those. And then, as we mentioned, for chronic pain, you know, the nonsteroidals will eat up your kidney and they'll hurt your gastrointestinal system. And nobody wants to be on opiates because they're so addictive. If you can avoid them, if you need them, you need them. But so I think that in a lot of cases, cannabis is a lot safer than the other molecules, than the other medications that we use, which is interesting. In Colorado, when they legalized medical marijuana, actually, when they legalized recreational marijuana, the Medicare prescription rates for medications across the board went down. Like all the prescriptions went down. So I think people were using medical marijuana instead of Viagra, instead of Advil, instead of you know, oxycodone. I think people started substituting just because it was less toxic and honestly probably more fun as well. But there are definitely possible harms. You certainly don't want to use it before driving. You know, it does make people cautious. They say that people who are on alcohol go through a red light and people who are on marijuana stop at a green light. But you absolutely don't want to drive on it because it can affect your reflexes and your sense of distance and reality. As we mentioned, smoking is harmful no matter what you're smoking. It's less harmful than tobacco, but it can cause this chronic bronchitis, which is very bad for you. And some people can become very dependent on it. I've certainly seen some people like try to smoke their lives away. And, you know, it's not as addictive as alcohol or opiates, but it certainly can be addictive. And, you know, that can be a real problem. So, because it does cause a euphoria, which is why people are attracted to it recreationally. In the same way, it can cause a dependence. So there's no free lunch, and you have to consider these things before using them. Next slide, please. There are a couple officially government-sanctioned, approved cannabis-like drugs. Dronabinol, which is Marinol, is for nausea and vomiting. It's basically THC. The problem is that's one of the 600 chemicals. And people think that the 600 chemicals work together much better in concert than just the THC by itself. So dronabinol isn't very popular. It's good if you're in a state where it's illegal and you have no other choice. It's better than nothing. But people like medical cannabis a lot better. And the other one is nabilone. That's a synthetic THC that has some psychiatric effects. So again, these medications are better than nothing, but patients vastly prefer medical marijuana itself over these synthetic medications. Next slide, please. And now we're, I guess, up to the alcohol section. So I'm gonna cede the mic.
Thank you. Thank you so much, Dr. Grinspoon. And, you know, really part of our interest in having this topic discussed was because so many of you have asked questions over the series. This is our 6th and final, and there have been a lot of questions about medical marijuana and the role in cancer therapy. The 6th pillar of lifestyle medicine is avoiding the use of risky substances, but we recognize within the cancer community that sometimes there is a utility for the use of certain substances, including marijuana derivatives, in the amelioration of symptoms. We look forward to the end of our presentation so that you might be able to ask questions, particularly of Dr. Grinspoon, that may address some of the questions that have come up along the way in this series. I'm going to take over from here and talk a little bit more about the avoidance of risky substances. This is one of the 6 pillars of lifestyle medicine, an important one in terms of an overall wellness vision. And it does have certain recommendations from the American Cancer Society that I'm going to review. The less alcohol you drink, the lower your risk from cancer. There are specific guidelines recommended by the American Cancer Society. They recommend that men not drink more than 2 alcoholic beverages per day and women no more than 1. What this figure illustrates is what 1 drink constitutes. That can be a can of beer. It can be 5 fluid ounces of table wine or a shot of a spirit. Volume doesn't equal alcohol quantity, so be aware of what you're consuming. And next slide. Why does alcohol use raise cancer risk? So how does this relate to your risk of getting cancer or having your cancer come back? When you drink alcohol, your body breaks it down into a chemical called acetaldehyde. This damages your DNA and prevents your body from repairing the damage. When DNA is damaged, a cell can begin growing out of control and create a cancer tumor. That's the basic biologic hypothesis behind the risk of alcohol consumption. Next slide. Is it safe for someone to drink alcohol while undergoing chemotherapy? This is a question that my patients ask me very frequently. All cancer types are different. All therapies are different. So if this is something that is a part of your life, it is important to discuss it openly with your oncologist. There are different times in therapy where consuming alcohol can be better or worse for you. Alcohol can affect your platelets, which are an important part of your clotting mechanism in your blood. If you're on a therapy that lowers it, your team would need to be aware, and there may be restrictions placed around that. Next slide. Tobacco and alcohol combined are independently associated with the development of multiple types of cancer. And this risk is only additive when the 2 are combined. Following a cancer diagnosis, continuing to smoke or drinking problematically is associated with a lot of adverse outcomes. Next slide. There is help. If you have a desire to quit smoking or to diminish your alcohol consumption, this is something that you should talk about with your cancer providers. We have resources here at our cancer center, but they will help you, because we know that reducing the amount of tobacco or alcohol can reduce the complications of cancer treatment. Specifically, if you're having surgery, quitting pre-op can lead to decreased rates of post-operative complications. This is definitely true in the thoracic oncology population. If you're undergoing radiation therapy, smoking can increase the toxicity of that therapy, making your symptoms that you experience worse. And if you're undergoing chemotherapy, smoking can reduce the efficacy of some of the agents or treatments that you are receiving. Next slide. As I mentioned, there are different modalities that can be used to help you in smoking cessation. There are psychological interventions such as cognitive behavioral therapy and positive psychology that are proven to have benefit in smoking cessation. There are protocols that are structured according to your readiness. Not everybody is ready to quit. There's a process in getting ready to quit, and that can be helped. There are telephone-based tobacco counselors here at MGH. So especially now during COVID, this can be particularly helpful if you're seeking assistance but don't necessarily want to or have the ability to come into the cancer center. And so there are resources, as I mentioned, that can help you work on smoking cessation. Next slide. There are also FDA-approved drugs. People who are smokers may be familiar with these. There are nicotine replacement therapies. These can be patches. These can be lozenges. You can combine them. There are medications as well that can be prescribed to help patients with the process of quitting smoking. If you talk to your provider, they can assist you with that, or they can help connect you with your primary care physician to aid in this process. Next slide. So Dr. Grinspoon touched on a little bit the need for pain medicine. And so this is something I want to spend a few moments really discussing, because while we talk about reducing risk, many cancer patients require the use of opiates as part of their pain moderation. For example, in my cancer, multiple myeloma, it is not often safe for patients to take medicines like the non-steroidal anti-inflammatories like ibuprofen. As Dr. Grinspoon pointed out, they're very hard on your kidneys. My disease is associated with problems with the kidneys. So very often we rely upon opiates for pain control. And so when we use these, there's an awareness that there's a balance between trying to come up with a safe therapy for patients that meets both their pain needs, but also is in line with the specific therapy that they're receiving. Next slide. So in terms of using opiates, it's very important that your medications come from one provider so that they're aware of what other medications you're taking. Opiates can interact with other medications, and so it's important that, and they can be cleared by your kidneys, and so proper kidney function needs to be assessed in terms of dosing, also align with the right choice of opiate, and they may affect people differently. Different people have different tolerances, particularly if they've never taken medicines like these before. So it's very important to start low and move high with someone carefully overseeing your use of these medicines. You will always be asked to sign a contract with your providers here at MGH. We do typically use signed written prescriptions for opiates. Now at MGH, we can electronically prescribe, but in general, this is heavily tracked and regulated by the state. You may only receive narcotic prescriptions from one provider. And your pain medicines will be watched closely, both to adjust them if pain needs increase, but also to decrease them if your pain needs go down. Patients often ask if they're going to become addicted to these medicines. We try to avoid that at all costs. We try to minimize our use and to level our doses with your level of pain and cut them back as quickly as we can using adjunctive therapies when possible. It's important to know, though, that the side effects, making you feel sleepy effects of narcotics should not be combined with other substances like alcohol or sleeping medication. This can lead to overdoses, difficulty breathing, confusion. Patients should not operate motor vehicles if their dose is making them feel sleepy. And so, do not take, the general recommendation is not take more than you need, and do not take them unless they're being properly controlled and in a relationship with a provider. Next slide. So we've covered a lot of topics, and we really want to leave time this evening to answer your questions. We had also covered a lot in the last 6 weeks, and we wanted to have Dr. Millstein briefly go through some of those highlights, reminding you that following this 6th and final webinar, the other recordings will shortly be uploaded to our webpage at MGH so that you can listen to any that you might have missed. And again, at the end of this discussion, we'll look forward to hearing your questions.
Okay, thank you so much, Dr. O'Donnell, for that incredibly informative overview of substances, and Dr. Grinspoon for the background information on medical marijuana. So as Dr. O'Donnell mentions, I'm going to take us through, running through, actually, it's a physical activity pun for our first topic, but I'm going to run through our last 5 weeks of topics here. Feel free to ask questions at the end, because I'm going to probably end up going through this quickly. So let's get started. Next slide, please. All right, so we're going to start with the physical activity pillar of lifestyle medicine. Next slide. Okay, why exercise? Well, I think it's probably pretty self-evident at this point. But in terms of exercising, there's lowered cancer risk across a number of different types of cancer. And there's a couple of different types of exercise that are helpful. So for aerobic exercise, we know that it reduces fatigue, insulin resistance, which is to say prediabetes, and hip circumference, so a measure of girth or BMI, that sort of thing, of weight. Improve cardiovascular conditioning and quality of life. This is key pre and post-op, for instance, in a cancer like lung cancer. Strength training is another key part of physical activity, the recommendations, which we'll talk about next. That's the idea of resistance exercises, lifting weights, sit-ups, push-ups, that sort of thing. It decreases heart disease and also increases in muscle strength, cardiopulmonary function, and quality of life, as well as glucose control, all of which are important for cancer prevention and also functioning. Finally, flexibility, that type of exercise improves as well. And this is important to people because it really can improve your physical functioning, which can maintain your independence for longer and make you just feel better. So let's go on to the next slide, please. The ACSM is the American College of Sports Medicine. There are recent additions to their recommendations, which we'll talk about here. The idea here is to exercise at a moderate to vigorous level, which is to say moderate being that you can talk while you're being active, but not sing. This is the equivalent of a brisk walk. Vigorous is that you can, it's hard to talk when you're exercising, so jogging or quickly biking. The recommendation is for 150 to 300 minutes per week. And some combination of moderate to vigorous. And so if we break that down a little bit, you can kind of divide by the number of days that you wish to be active, but by and large, if you aim for moderate intensity aerobic activity, again, so kind of a brisk walk, plus resistance exercise 3 times per week for at least 30 minutes, it's a good place to start or even to aim for as you're getting stronger. So let's go on to the next slide for some general principles. So independent even of those recommendations, think about doing something you like. That is the best way to sustain this physical activity behavior. You gotta like doing it, or it's a lot harder to keep going. So find something, whatever it is, start slowly and build up. Again, the ideal would be 30 minutes or more of moderate activity every other day, and think about trying something new or trying a class. There's so many videos now online. We'll tell you about some specific ones in a few slides. Zumba, yoga, Pilates, whatever it is that might be fun. We encourage you to try it, especially now during COVID. There's just a real increase in sedentary time, which is an independent risk factor for all-cause mortality. Next slide, please. So, right, our favorite couch potato. The pillars of lifestyle medicine encourage an avoidance of inactivity. So if you remember nothing else about physical activity, try to reduce your sedentary time, which is sitting, lying, watching TV, screen time, that sort of thing. In terms of your cancer progression and pre and post treatment, try to get back to your baseline. Try to get back to your normal activities as quickly as you can. That's really just a general principle that you can follow. And then again, continue doing your normal daily activities and whatever exercise you had been doing previously, if any, as much as you can during and after treatments. It may feel counterintuitive, but exercise does reduce cancer-related fatigue. Let's go to the next slide. Okay, as I mentioned, so this is a group of videos that Dr. O'Donnell pioneered last year, along with our colleagues in the lifestyle medicine program. And these can be found for free on YouTube or on the MGH Cancer Center website. You can Google them if you'd like. Just Google exercise videos for cancer patients. And it's a series of easy, medium, hard yoga and Zumba. And there's a sequence, actually a schedule on the Cancer Center's website where you can find a recommended progression. Give them a try. They're lots of fun and really, I think, inspirational. And I think you'll find that you can do it no matter what level that you happen to be at this point. Okay, that's a lot of physical activity. Let's move forward into nutrition. So I know a number of you have been on either all or some of these webinars. So some of this will be review and maybe new for others. Let's move to the next slide. There is so much to say about nutrition. And again, we'll direct you to our website when these videos are posted so that you can watch the entire nutrition webinar from several weeks ago. It was excellent and you'll learn so much. You'll absolutely learn something new. But the bottom line here is focusing on diet quality. There isn't one kind of best diet because the studies just can't give us a best answer for human health. And that study probably can't be done. You can't fully randomize people to these different diets with 100% fidelity. So the best diet is a theme or an emphasis on vegetables, fruits, whole grains, beans, lentils, nuts, seeds, and water. So as you're seeing on the left side of this healthy eating plate, you'll see half of this plate is fruits and vegetables. And within that, more are vegetables than fruits. More like 2/3 to 1/3. Healthy oils is on the left. Oils are healthy oils, liquids are good for our heart. So you don't have to be fat phobic, although saturated fats, so kind of the solid fats at room temperature, those are more dangerous. On the right side, you'll see that the other half is half whole grains, half healthy protein, which is to say brown rice, barley, those kinds of whole grains, not the white version. Those are the refined grains, very much less good for us. And then healthy proteins. So these are lean proteins, fish, poultry, beans, etc. And as you'll see on the top, water. So trying to reduce or eliminate sugar-sweetened beverages. So, sodas, energy drinks, even some juices. So the main message here is focusing on diet quality, which is summarized on the next slide. So some of you may have seen this. This is a book by Michael Pollan, who's a really wonderful writer. If you're interested, just remember this, if nothing else from the nutrition slides. Eat food, that is to say real food, not processed food, not too much, so not overdoing it, eating till you're just full or just below that, and mostly plants. Okay, so if you can remember those three things, you'll be in great shape. And we'll talk about some tips for success. I'll just get us started and then we'll go into the next slide. So again, there's so much to say about this, but here's just a sampling. Thinking about adding additional flavors that aren't in the form of fats or salt or sodium. So lemon, zest, vinegars, or different flavors that don't add calories but do add kind of excitement. Spices, so turmeric, you can add that to almost anything, or other herbs, maybe things that you've tried and liked in the past, or maybe things you've never tried before. Get some tips from a nutritionist or a dietitian or even friends. Some other tips: keep frozen fruits and vegetables in the freezer. Roasting vegetables, so just putting them in the oven at a high temperature maximizes flavor. Keeping kind of snacking fruits and vegetables ready and on hand. It's so much easier to eat healthfully and eat those fruits and vegetables if they're ready. As someone once told me, you don't have to peel an Oreo. And I think about that all the time, right? So if you have to peel it, it's a barrier. It's harder to do it. We're going to be less likely to do it. And keep the Oreos maybe out of the house as well. But keeping carrots, cucumbers, zucchini, or a fruit bowl kind of at the ready, at hand for snacking. Adding a fruit or vegetable to breakfast, maybe a smoothie, that sort of thing, or any sort of fruit or vegetable. Trail mix, nuts and dried fruit. And then again, finding bloggers or recipes that really do give you some inspiration can be helpful. Okay, next slide. Okay, so in terms of supplements, I'm going to summarize here by saying that supplements should not be used to prevent or to treat cancer, of course. You've probably heard of lots of supplements. There's a lot of hype around supplements. The supplement industry is completely unregulated, and it's not, they're not recommended. The studies that show people who have high levels of these particular supplements in their diet may do better. But when you isolate that molecule or that substance, that supplement, and take high doses of that, the studies do not show that to be beneficial. In fact, most show that those are harmful, and some can cause cancers as well. So ask your doctors, ask your nutritionists, but don't try to take them on your own, and certainly don't try to take them to prevent cancer. And some of them can have a negative impact when on chemotherapy. All right, that was a lot on nutrition. So let's move forward. Next, we're going to talk about sleep. Next slide, please. We all know that sleep is really good for us, and we also know that sleep can be hard to come by. It's an extremely important part of human health. This infographic shows how much sleep is recommended that we typically need by age. So you'll find the number of hours on the bottom in the blue line, and the age is kind of going on an arc across the top. Find where you are, find your number of hours. Most adults need about 7 to 9 hours with individual variability. We spend up to 1/3 of our lives asleep, so that is not wasted time. We need it to survive. Our brains are very active during sleep. It regulates our circadian rhythm, which is to say our light-dark, our sleep-wake cycles. It regulates neurotransmitters that promote growth. It also allows our brains to rest. It affects our daily functioning and our physical and mental health in so many ways. And again, this is intuitive. You know this from your own lives. Let's go to the next slide. However, in cancer treatment, sleep disorders are much more common for anyone with cancer. That may be due to the physiological factors. So if you're having pain, it's so much harder to sleep. Anemia can cause fatigue as well. Psychological factors, maybe you're feeling anxious about your cancer or the treatment, or any number of things can cause anxiety. And depression. And if that's the case, we encourage you to talk to your providers and get help. It's normal, and there is help available. Of course, this can lead to fatigue and poor sleep quality. Chronobiological factors, so there can be cancer-related disruptions to our sleep and circadian rhythms. That can be related to treatment side effects or physical changes caused by the cancer, depending on the location or type. And finally, there can be social cultural factors. There's just a lot of other factors in our lives that contribute to fatigue and poor sleep quality. Sometimes it's where we live. Sometimes it's too noisy, or sometimes it's too bright. We need dark and we need quiet to sleep. So there's a lot of factors, and we encourage you to think about which ones you might be able to modify. So let's talk about that. Next slide, please. Okay, so sleep hygiene is kind of a fancy way of saying that our behaviors matter when it comes to promoting healthy sleep and restful sleep. So the basics of sleep hygiene are to find a routine. Our bodies really thrive on regularity and a routine. And that is no exception for sleep. So try to find a time when you can go to sleep at the same time every night. And even more importantly is getting up at the same time every morning, including weekends. If it's hard to wind down to go to sleep, set yourself a routine, something that you can look forward to, something with relaxing music or a bath or, essential oils scents if that helps you relax, journaling or reading a book, but try to avoid blue lights like from your phone or a tablet before bedtime. Lose the substances. If you are a coffee drinker or have some kind of other caffeinated beverages, stopping that around noontime because it does impact our sleep. And not using alcohol, to touch back on our substance topic, not using alcohol to try to fall asleep. It backfires. Alcohol has a rebound effect, and it may feel like it's putting you to sleep or making you drowsy, but about 4 to 6 hours later, it wakes you back up. So it really promotes poor sleep quality and early waking, and it disrupts your sleep cycle. So if you exercise, do exercise, but try to do it before, an hour or two before bedtime. Otherwise you can heart rate can be up and it can be hard to come down from that. So some tips here, again, there's many more, and we can talk about those in the questions or with your provider. So next slide, please. We talked about, caffeine, nicotine, alcohol, and eliminating those, reducing them at least at night. Reducing high sodium foods at night or late night snacking. That's because that can cause you to feel too full to sleep, or it can make you drink more, which can wake you up if you need to go to the bathroom overnight. And again, trying to avoid the use of blue lights, which is to say screens, within 30 to 60 minutes of bedtime. That blue light tells our brain to wake up, tells our brain it's daytime. It reduces the production of melatonin, which is a hormone that we need to fall asleep. If you're having trouble sleeping, experiment with any of these factors, because you may find that one or many of them can help. Next slide, please. All right, let's talk about social connections. We are going to start zooming forward, so we can go to the next slide. Social support is the most important predictor of human happiness, which is to say quality of life, and longevity, actually. Really, really important for our health, as you probably are aware. Blood pressure, heart rate improve, even with little bits of positive social interaction. So let's move forward. So when it comes to cancer and cancer treatment, your cancer itself can be an isolating experience if you don't know people going through it at the same time. You can be in treatment sessions for a long time. Being immunocompromised, if you're doing chemotherapy, may require you to limit your exposure to the outside world, which actually we're all sort of feeling now during COVID. So cancer patients have a lot to teach us about how to cope with that. And you can help your friends as well in that respect. Isolation can occur, again, if your peer group is not doing the same thing that you are with similar experiences, you can feel more vulnerable. And so let's talk about what we can do about that. So next slide, please. We encourage you as much as possible to connect with other people. That can be online. That can be as simple as smiling at someone walking down the street if you're outside, wearing a mask, doing social distancing, or physical distancing, of course. Try to connect in small ways as you can. If you use the internet to connect with other people, you can find people at the same stage or the same type of cancer that you may be dealing with. American Cancer Society has online communities. Cancer.net is another. Or you can talk to your provider, and we'll show you the supportive care calendar from the MGH Cancer Center in a few slides. And finally, just a note, if you use social media, again, there's much good that can come, but just like Dr. Grinspoon talked about with medications, everything has kind of an equal and opposite side. And so if you use too much social media, those people in studies do seem to have more depression or depressive symptoms. You're at higher risk for depression with more social media use. So just be mindful of how you use technology. And if it's something that is actually causing you to feel worse after or during your time on the internet, think about cutting down. It's a pretty simple and effective way to manage mood. Okay, next slide, please. Let's talk about stress. We all know what stress feels like. Stress, when we say that word, it tends to mean negative stress, but there's also good stress. We need some stress to keep us going. But let's go to the next slide. But in fact, bad stress or distress affects our entire body. We have really powerful stress hormones that circulate throughout our bodies. We need those. We need that fight or flight response. We need that heart rate to go up. We need our breathing rate to go up. We need the blood to go away from our digestive tract and into our muscles so that we could fight or flee from any kind of predator or danger. However, when that stress system is turned on for too long or too high, like an alarm system that's going off way too much, that's not helpful, that's when we need to start thinking about managing our stress. So if you're experiencing any of these kind of stress-related symptoms, so muscle tension, your jaws are clenching, or you're noticing your heart's beating fast, think about finding some stress management solutions. So let's move to the next slide. Okay, there's mind-body therapies, meditation. If you don't already, we encourage you to find something that works for you. There's apps like Headspace or Evermind that can be really helpful. Talk to your doctors about those. Physical activity is a stress reducer. Eating well, taking care of our emotions, laughing, expressing gratitude, all very helpful for stress. And again, finding these social supports are really instrumental for managing stress. Of course, when we sleep better, our stress is lower as well. Next slide, please. Okay, so stress awareness. We got to be aware of our stress. We need to know what our stress signals are before we build our toolkit of coping resources. But our toolkit can be things that improve our positive emotions and our health behaviors. It's not simple, but once you know what to look for, you can know which strategies to put in place to help you feel better, in the short term and the long term as well, so that your spots don't fall up like this leopards. Okay, final slide, and then we'll turn it over to Dr. O'Donnell for the wrap up. As I mentioned, meditation can be incredibly effective. We know it modulates all of our physiological processes involved with stress. You can be a Buddhist monk, or you can be a kid, or you can be anyone in between. Anyone can do this. It's accessible to all of us. It's about being present in our present moment and reducing the judgmental thoughts that we have, just letting the thoughts be there. And if you're someone who finds mindfulness or meditation in movement, like yoga or jogging or hiking or being in nature, then that's your meditation. Use it as much as you can, and you will find a calming benefit. Okay, I'm going to turn it back over to Dr. O'Donnell for the last few slides, and then we'll go to questions.
Next slide. Once again, I'd just like to thank everybody for joining us for this series, and to thank my co-hosts for participating. We are fortunate to be a general hospital and to have a broad range of services available for our patients. Just to highlight the Katherine Gallagher Integrative Therapies program. This does provide acupuncture, massage therapy, music therapy, art therapy, yoga, and Tai Chi free of charge to any patient of the Cancer Center. So please be aware that resource is there for you. These are intended, just as we've talked about, to manage side effects of treatment, but also to mitigate anxiety and stress. These services are available in the infusion unit, in radiation therapy, and in the inpatient services as well. More information is available on our website. Next slide. We do have a whole host of supportive and wellness programs that are available. We keep an active calendar on the MGH website, so please refer to that if you're looking for these resources. We would love to have your participation, and you can certainly call, and we can give you, speak to someone who can help guide you to the resources that you need. Next slide. So once again, thank you. I also want to mention that if you would be interested in being seen or having these discussions about lifestyle medicine, we have a clinic both in Boston and in Waltham where we can provide personalized consultations to address your lifestyle needs. This would also include a consultation with nutrition. You can be referred by your oncologist, but you do not need a referral. You can self-refer for that, and we'd be happy to see you and to work one-on-one with you with your personal wellness vision. And so now I think we can turn to the questions, and please feel free to write in if you have any specific questions. I see we already have some, and Dr. Grinspoon will be tapping you for your expertise on this. And this is a really important question about prescribing medical marijuana. And so hopefully you can comment a little bit on the process of how one can find a doctor and how one can obtain medical marijuana and what that process entails.
Well, can you guys hear me? This is always a problem because it should be illegal federally, and it should be done like through oncologists and primary care doctors. And that's what it will be like in 5 or 10 years. But we're not there yet because it's very complicated. I won't go into the whole history of like the war on drugs and stigma and all that stuff. But fortunately in Massachusetts, it is legal both medically and recreationally. So you could just go to a store and buy some marijuana and use it. Now, the recommendation is to start low and go slow, because the only way to get in trouble really with marijuana is to take too big a dose. You know, people go in and say, wow, that brownie looks delicious, and take a huge dose by eating a brownie, and then they get very anxious and have an awful experience and then never use it again. But it is much better to work with a medical cannabis specialist. The problem is there aren't that many of them, and they tend to charge, some of them tend to charge a huge fee. So I would just say that I can work with Dr. O'Donnell to put O'Donnell to put you in touch with to medical cannabis providers if anybody in particular needs to be put in touch with one, because it's a little bit of a minefield because some of them take advantage of people and others are really outstanding. And I don't want to start giving out names right now, but the advantages of getting a certification in Massachusetts are you don't pay 20% tax. You go to the front of the line, so you don't have to wait behind all the college students, which is really great. And you just get really good service. And also you get to speak with a clinician who can talk to you about different strains, different strengths, different, the smoking versus vaping versus the tincture versus an edible. And they're very knowledgeable. But again, it's important to find the right person. So if anybody's super interested in this, I'm happy to work with Dr. O'Donnell to find you someone.
Thank you so much for that. And just another follow-up question is, are there long-term side effects associated with too much medical marijuana intake?
Yes, you end up using less opiates and less alcohol. No, I'll give you a serious. People are concerned about the effect of marijuana on the teenage brain. So people are very concerned if people start smoking at age or using it at age 15, 16, or 17. And that is a concern. People are concerned if you start using it in pregnancy because it may affect the fetus, and people are concerned with it in breastfeeding because it can affect the breast milk and consequently can affect the newborn. As for adults, there's been a lot of research and they haven't really shown much. The acute effect of intoxication, you certainly don't want to do it before working or before driving, but they haven't really shown that it affects memory or cognition in adults. It's never been linked to lung cancer, but again, we don't like people smoking it, but for the record, it hasn't ever been linked to lung cancer or COPD. People with cancer who have used cannabis, they've done these huge studies in Israel, quite reliably, the numbers are in the 90% range, do report like higher quality of life, less opiates, so it's very important for end-of-life care. People use many fewer opiates. They're much more emotionally available. They're much more awake and cognizant, conscious for their loved ones. So again, aside from the acute intoxication and aside from the triad of, breastfeeding, pregnancy, and teenagers, it's a fairly non-toxic medication that's been used for 5,000 years. So and the final thing I'll say is, I always compare it to what else would we be using? And for pain or for insomnia, there are long-term concerns with any medication. All the sleeping medications cause, we're afraid that they're risk factors for dementia. And we've already discussed all the pitfalls of the pain medications. So the sleeping medications and the pain medications are pretty dangerous. There's been such a snow job by the pharmaceutical companies to make us think these things are safe. So I personally think that cannabis is just a lot safer than many of these other medications that we use.
One other question that perhaps Dr. Grinspoon, you might want to comment on as well, is what strategies are there to cope for cancer-related pain if you have a history of addiction? This is a very important question, and this is something that I encourage you to be very open with your medical oncology providers with, so that they can help find you the resources to both support you as you go through treatment, but also properly treat your pain and your concerns around your pain. Dr. Grinspoon, if you want to comment on this as well, we'd appreciate your expertise. But again, it's minimizing doses, setting short duration of therapy if there's pain that is expected to be for a finite period of time, such as around a surgery, and really helping patients partner with either a family member to administer medicines. Dr. Grinspoon, I know you have some thoughts on this as well.
Well, two thoughts. Two main thoughts. I have about 1,000 thoughts, but one is, again, not to beat a dead horse, but cannabis is less addictive than the opiates. So for a lot of my patients, I just use cannabis instead of opiates, and they find pretty similar pain control. Now, you can't always do that because opiates are stronger for pain. If the pain is really bad, you have to use opiates. You just don't have a choice. And this is going to be, I believe, in the supplemental materials that we're going to provide. I wrote something about this because this is a very long story, but in my distant past, I suffered from addiction. And then in my not distant past, I had to have a surgery. And there are very safe ways to use opiates if you've had a history of addiction. You can have, again, being, as Dr. O'Donnell said, you have to be open and honest with your caregivers and with yourself most of all. And you just have to have people on board with what you're doing and know that you've had this addiction history, and be with you in the process, walk through the process with you. And if you start finding that you're having cravings or having temptation to misuse the pain medication, which a lot of the time, frankly, doesn't happen because people are often addicted in a very miserable, dark time in their lives. And then later on in their lives, when they're in recovery, they're often a lot happier and more centered. And then they happen to have a surgery and need pain medications. And it often turns out to be not that big a deal. But if it does start to be a big deal, you could have your partner lock up the pain medications and just give you 2 Vicodin every 6 hours, instead of like having the whole bottle by your bedside where you'd be tempted to keep taking more and more and more. There are a lot of things you can do, but it does come down to openness, honesty, and just a couple common sense tactics that people have developed over the decades. A lot of people have gone through this. A lot of people have gone through it safely, and there's been a lot of discussion about it, and they've come up with some very safe and common sense kind of tactics to deal with this problem.
Thank you so much for that response and for sharing that with us. We have limited time remaining and several questions, but several of them involve the same theme, which is if you're going through chemotherapy or radiation, do you have to be going through chemotherapy or radiation to be eligible for the services? You do not. Any patient who is part of the Greater Cancer Center is welcome to use the Integrative, the Gallagher Center Integrative programs. As noted, the exercise videos are free for anybody who wishes to use them. We will send out a link after this program with access that provides access to or provides the addresses for the websites that we have noted so that you can reference them. If you are looking for the exercise videos, you can Google MGH exercise videos cancer and they will come up. They're also available on YouTube. We've also had some participants ask how to contact the Lifestyle Medicine Clinic. We will send that link along as well in our follow-up email. Yeah, I think we're at time, but I just want to thank everybody so much for their ongoing support of this series. I want to thank my co-host this evening, Yael, for all her hard work, and welcome you to reach out to us if you have any lingering questions or can benefit from any of the services that we have to offer here at MGH. We'd love to help you. Have a wonderful evening. Take care.
Thank you. Just to echo out that, thank you everyone so much. Thank you to our awesome hosts tonight for such a thoughtful and interesting presentation. Whether you're a newcomer or this is your 6th session, we really appreciate your interest and we're looking forward to further programming in the future. Have a great night.